Hi everyone, it's Dr. Danielle Cooper here, plastic surgeon. Today I'm going to discuss things to know about a breast lift or breast reduction and with or without an implant. So the first thing to know about a breast lift or a breast reduction is that it is essentially the same procedure. However, a breast lift is removing just enough tissue to lift the nipple, whereas a breast reduction is removing more breast tissue in order to truly reduce the size of the breast itself. But the same principles we use for a breast lift, we use for a breast reduction and vice versa. So with that procedure, we are making cuts in the skin in order to lift the nipple into a more youthful position. So as we age, or if we have children and we breastfeed, our breasts will change. And usually gravity wins and things go lower than we like them to be. So with these procedures, we lift the nipple into a more youthful position. One question that I do get a lot with patients that are coming in for breast reduction is, oh, well, can I get a breast lift as well? A breast reduction automatically includes a breast lift. So again, it's the same procedure. It's just a matter of how much breast tissue am I removing during this lift. Am I removing just enough to lift it? That would be a breast lift. Am I removing it, but am I moving it up as well as trying to reduce the size? Then I take more breast tissue to reduce the overall size of the breast. You get a lift either way, even if it's just a breast, even if you're coming in for a breast reduction. So typically, particularly with our larger breasts that are for patients that are coming in for breast reductions, you're going to have an incision around the nipple, down and into the fold of the breast. We call that the anchor pattern or the Wise pattern incision, and that allows us to really reduce the size of the breast envelope and create a nice round mound for you postoperatively. And during the procedure, we have to keep in mind the blood supply to the nipple so that during your recovery, the nipple has enough blood supply and it will survive. A rare but serious complication that can happen with any breast procedure, where you're making cuts around the nipple at least, is that you could lose your nipple. That is a serious complication. Like I said, it's a rare complication, but it does happen. And so you have to understand that that's a possibility and be okay with that risk. Even with this, even if it's just a breast lift, we're still making those same cuts around the nipple. As surgeons, again, we know where to make our cuts in order to preserve the blood supply to the nipple, but things can still happen and you could lose your nipple. So you just have to keep that in mind when you're deciding to go forward with these procedures. Depending on how much of a lift you need, we may be able to adjust what type of scars we have to give you. So instead of that Wise pattern scar, which is that anchor scar around the nipple down into your fold, we may be able to just do a lift around the areola, which is the colored part of the nipple, or we may do what we call a lollipop incision, where it's an incision around the nipple, but then also a vertical line that extends from the nipple down to the fold. But that will all depend on how much of a lift you need and how much extra skin and breast tissue you have. That will give us the best shape to the breast postoperatively. Now, if you're wanting to add an implant to your lift or reduction, and some people do, even though they might want a breast reduction, they still may want that upper pole fullness, that roundedness, that cleavage look, and that you get with an implant. Even if you have a lot of breast tissue, depending upon the quality of your breast tissue, even with the reduction or the lift, you still may have a little bit of a slope to your breast, which is a natural appearance to the breast. However, some women still prefer to have that full round cleavage look, and then they would benefit from having an implant placed as well. And so usually we are placing that implant underneath the muscle to preserve more of that blood supply to the nipple. Again, implants, and I said this in my other video about implants, implants are not lifetime devices, so we'll place them, but 10, 15, 20 years down the line, you will have to come back and have your implants replaced, either because they've ruptured or just with time, things have changed again and you need to have a revision, either due to the implant and or due to your lift. So even though we do a breast reduction or a breast lift, we still age. So it does not mean that you get a breast reduction or a breast lift and you're good for the rest of your life. That's not how it works. in 10, 15, 20 years, gravity will still take a toll on you and you may be coming back for another lift. So this is also another thing to keep in mind. But I would say that our breast reduction patients are one of the most happiest patient cohorts because they're dealing with a lot of physical complaints related to the size of their breast as well. So back pain, neck pain, rashes. And so we're able to address that with a breast reduction. So they tend to be very happy patients because now they have this relief off of their shoulders, literally. And they can wear normal bras and go back to exercising. Life just becomes a little bit more easier when they have all that weight removed. So I hope that gives you guys some information on the procedures and maybe even enlightening you guys to know that a breast reduction includes a lift, that they're actually the same procedure. It's just the amount of breast tissue we remove. So if you guys have any questions, leave them in the comments below. I'm happy to answer them.